Yes, it is true. I am not a medical practitioner, but this doesn't delimit us to explore information because these days information are available and we can tap it as our resource, and it's up to us to filter what information and advice we can have. Of course, if you are going to be consulting a medical practitioner, they're giving solutions to your problem or sickness, and that is why today we're going to give you remedies. Remedies of stiff neck or neck pain. Just a little review. In the past video, we revealed to you 3 reasons why you have stiff neck or why you are experiencing neck pain. Number 1, muscle strain. Number 2, cervical disorders. Number 3, infection. If in the past, after watching that video that I featured, it might be helpful and perhaps you went to a doctor to subject yourself for laboratory test or consultation, please leave us a comment on it. However, today we are going to explore about neck pain remedies. Join me in exploring.
Okay, last video on common office type complaints people come in with, and last one we're going to talk about is the neck. So we've done how to sit, we've done how to stretch your chest, tiny step back. Now we're going to talk about neck pain. Neck pain is very common for people who work in offices because they always heads held forward, staring at monitors all day, and then they come away with a really stiff neck. Rather than go with stretches like I did with the chest, I thought I'd do some self-help techniques, okay? So here we have a neck. This is Maud, married to Derek, and this is the back of her neck. Okay, so you can see the base of the skull, and you can see all these little bony prominences coming out. What you want to do when you feel your neck sticking out is you're going to get your fingers, find those bony prominences, and then sink off into the soft tissue. Okay, so you make a look at the hand. You'll find, even if you can't feel the bony prominence, you'll feel a definite dip between the soft tissue, and you come off to the side your hands on, so you're hooked into this tissue here. And then it's just a case of cranking your head the opposite way, cranking your hand around. So as your head goes one way, your hand goes the other, and you can strip out this tissue. And it feels really nice. I bet it can help loosen off some of this muscle, make it feel a bit easier. Here's the good one. Okay, so you sat here doing this, you're like, oh, that's nice. That's alright. Bother me, that's all right. So you're on a tender point, okay? Trigger point, not whatever you want to call it. So I've got my fingers in my neck now. I'm like, yeah, I can feel that. Take your head, keep the pressure on, but not too tough, just a bit. Take your head to the pain. Okay, so my pain's on the back right of my neck. So that's where my head goes. And you'll find the pain will drop, yeah? Then what you do, you apply, so we're going this way, a little bit of pressure and a little bit of friction. Just gently into the neck, and it feels quite nice. You haven't got any real pain here. And after about 10 seconds, start to straighten your head. If you come to here, think, oh, it's come back, go back, oh, it's gone. A little bit more pressure, a little bit of friction, and then just work it out. And then give it a neck a smooth. And then keep treating these little points you find, and it will help stop building the sense of tension and pain in your neck. You can do it, don't have to do it at work. I mean, if work, a little bit of stretch off now and then is nice. But when you go home afterwards and you're sat on the sofa watching crap TV, and you're like, oh, that was a crap day, you can then self-treat them. And if you self-treat them at home, chances are the next day, they're not going to be so bad. And then do my neck stretches. I've got loads on my website, so look at them. And I'm going to stop talking now because that's 3 minutes, so you must be bored. But that concludes my office work, self-help stuff. Thanks.
In today's episode, we are going to discuss stiff neck remedies based on cause by Dr. Grant Cooper, www.spinehealth.com. Neck stiffness is a common condition that can vary in intensity. Why is that so? Because there is stiff neck, even if you are just simply sitting and not moving. It ranges from general soreness that mildly inhibits neck motions to sharp or burning pain, similar with the illustration showing your neck having burning pain. It can also be diagnosed internally as per the illustration in the bone in the reddish color. It also flares when attempting even slight head movements. So even just like you are inclining to the right or to the left, yet you are still experiencing such kind of pain. And of course, there are treatments that we need to understand. So treating a stiff neck typically involves a combination of one or more of the following steps, especially if the stiff neck and the paining is recurring. It keeps on recurring even if you are already falling into a deep sleep and then you are awakened because of the pain. Number one, short rest period and or activity modification. So for those people, you should allow yourself to undergo some kind of changes or adaptation to the environment by also moving. Number two, applying ice pack and or heat therapy. This is really true to the athlete or athletes having injury and to the soldiers with whom in the illustration we can see heat therapy is being applied, and also with the use of a machine. This is like an electronic machine. Number three, gentle stretching and massage, to which each and every one of us are fond of doing and are happy to be massaged by other person. So just gentle neck stretching is one of the several common self-care strategies that can help you alleviate such kind of pain. And if you wanted to go to a clinic, then you can go for a massage service. Number four, over-the-counter pain medication. Of course, it is all available in each and everyone's country. There are pharmacy where you can get. The vast majority of stiff neck are acute and result from some type of muscle strain or ligament sprain when the neck gets overused or overexerted. Recognizing which action or environmental factors contributed to the stiff neck can help medical practitioners develop a treatment strategy and reduce the risk for recurrence. How stiff neck causes can determine treatments. This is an important journey for those who are seeking medical treatment because we are receiving diagnosis and of course treatment procedures. While it is important to treat the pain and limited range of motion associated with a stiff neck, the problem might keep coming back if the initial cause is not addressed. Some common sources of neck stiffness may include the following. Take note of number one, sleeping in awkward positions. When waking up with a stiff neck, it makes sense to evaluate the sleeping environment, especially if the bed or pillow is unfamiliar or new, because to some, having so much pillows may contribute discomfort on the neck and of course the head. The same goes for the firmness of mattresses and pillows, as no particular level of firmness works best for everyone. Therefore, we need to check the firmness of mattresses, and there is one mattress that is recommendable from Emporio, black color, Duke. Finding the right pillow and mattresses for better sleep comfort may take some time of trial and error, but you may use this U-shaped pillow, perfectly designed to provide the neck with comfort while sleeping, or to a mattress that allows your arthritic body to recline, just like this illustration. You have to look for pillows and mattresses which will provide you with comfort, and from time to time we need to evaluate. You yourself have to evaluate the sleeping environment. Number two, poor postures. If neck stiffness and soreness tend to develop toward the end of the workday or during a specific activity, such as while hunched over a computer screen for hours, just like in this illustration that you are hunched over a computer, maybe playing on your tablet, it may be due to a combination of poor posture, inactivity, and muscles becoming weakened or tightened. As a result of the poor posture, you are experiencing not only the neck but even side pain or back pain, and because of too much exposure or inclination towards the other side, like left or right, whenever you are talking, you are experiencing pain. And even if because you are idle or having no activity at all and overuse of your muscle that tighten it, using better posture in the workplace, such as by sitting straight when you are on a computer, regularly taking breaks to stretch your neck, like sitting up straight, be disciplined at all times. Of course, you are in front of your computer. Do not be abusive. You have to straight erect. May be key to preventing neck stiffness from returning. Well, that's our contribution. Number three, overexertion or overuse. Lifting a heavy item or performing an unfamiliar task can increase the likelihood of having you experience neck pain, just like this. Another person is lifting a heavy item, and the ligaments becoming injured due to overexertion or overuse, which can lead to pain and stiffness. This is what happens when your muscles are overused. There is bleeding inside, and the reaction of the person due to the pain of the overused muscles. And this is the microscopic events that took place within the muscle itself. When you are lifting or carrying a heavy item, it is important to keep the neck in a neutral position with the ears directly above the shoulder. Just like this one, you are in a computer, so there is a comfortable direction. If the head and shoulders are tilting at odd angles, such as leaning too far forward or to the side, maintaining a balance or momentum, just like this musician. The item is too heavy and the neck is at increased risk of becoming painful and stiff. This person is carrying liquid items on both ends of the shoulder. It's heavy. Number four, direct trauma. A stiff neck that occurs after direct trauma or accident may just be causing the muscle strains and the ligaments. There are zones on our neck, and the doctor should be able to identify which part of it. Is it being strained or the muscles are experiencing bleeding? This is the ulnar collateral ligament injury as illustrated. On direct trauma, it could also involve more significant damage to the cervical spine and other parts of the body. This is the illustration of thoracic and cervical spine injury. For a whiplash injury, which involves the head whipping back and forth, just for definition, whiplash is an injury caused by severe jerk to the head, typically in a car accident, just like in the illustration. The neck pain and stiffness might not show up until hours later or even after or even in the evening. Any neck pain or stiffness associated with a significant accident such as car accident or fall from a ladder, just like this one, it's a car accident and someone fell from the ladder, you should see a medical practitioner or the doctor for such matter. If a stiff neck is associated by a severe headache, fever, dizziness, and reduced coordination in the arms and legs, in the illustration, this lady is experiencing severe headache. This lady also is suffering from fever. and the other person is experiencing blurry vision because of dizziness. And the result shows a fracture and movement in the bones or other troubling symptoms. A serious underlying conditions may be present that require immediate medical attention, so you should see a doctor for such matter. Let's have a summary about stiff neck remedies based on cause. Number one, short rest period and or activity modification. Number two, ice pack and or heat therapy. Number three, gentle stretching and massage. Number four, over-the-counter pain medication. Some common sources of neck stiffness include: number one, it is because you have sleeping or you have an awkward position in sleeping. You are having poor posture. There is overexertion or overuse of your muscles. And there is a direct trauma